Go for it. That was President Obama's message to lawmakers when it comes to passing health care reform legislation. But the method on how to do it is just the latest snafu that has even congressional Democrats worried. Doug Luzader has more.
The doctors seldom wear their white coats outside of work, but this was part of some elaborate stagecraft at the White House as the president took one last stab at health care.
I believe the United States Congress owes the American people a final vote on health care reform.
His plan costs about $1 trillion over 10 years. Everyone will be forced to buy health insurance. There are a handful of Republican ideas, too, including cracking down on lawsuits and fraud. Republicans, though, say Democrats will pay a huge price at the polls come November if they force this through.
The president and the Democratic leadership are calling upon their members to ignore the wishes of the American people. We know where the people are. It's not even close.
And Democrats will have to use a special process called reconciliation to wedge this through Congress and avoid a Senate filibuster. But even that will be close, and House Speaker Nancy Pelosi has a tough road ahead.
Nancy Pelosi has told the White House that she has the votes and she's going to get the votes. And she's pretty reliable when it comes to these things.
That may be, but there are still some Democrats in Congress who simply will not budge on this.
They can break my arms. They can do whatever they want to. They'll never get my vote, ever. I mean, they'll have to walk across my dead body if they want my vote on this issue. This is so galvanizing in my district. I think the votes are not there, and I don't see where we get them.
So the bottom line, pass or fail, what does it all mean for the Garden State? Joining me now, Weissman, who is the health care campaign coordinator for New Jersey Citizen Action, and former state senator Richard Rossa, who is the founder of solutionsfornewjersey.com. So the new word of the week, reconciliation. So it would allow the Senate to pass health care reform with only 61 votes as opposed to, let me get that right, 51 votes as opposed to 60 votes, and only 216 in the House. But the process is only meant for the budgetary issues, usually. Should it be used for health care?
Probably not. I mean, you have a tradition in Congress, but when they have an obstacle to overcome in a political environment, they'll use whatever tools that are at their disposal. The nullification might run into another obstacle that people haven't really thought of, and it's a thing called nullification. There are 37 states at this point that have already either introduced or passed legislation that, for all intents and purposes, says that they will opt out. In other words, they will not be bound by whatever is passed in Congress. And the most recent example of that is there's a federal law that says that marijuana is illegal, yet New Jersey just passed a bill for allowing medical marijuana. So the fact that the federal government says you can do it or you must do it doesn't mean that a state has to do it. And there are 37 states that are in the process of trying to do the legislation to, for all intents and purposes, opt out of this health care bill.
Well, reconciliation, it really means one thing. It's pretty simple. It means that the Senate can pass a piece of legislation with a majority vote, with 51 votes. The reason for reconciliation is because the Senate has this funny rule called a filibuster, which means that one senator can block the majority of senators from taking a vote on a bill. So I actually think that reconciliation absolutely should happen to pass health care reform. Despite some of the quotes that we just heard, the majority of people do want health care reform to get done. Certainly the majority of people in the Senate want health care to get done. And, you know, there is huge precedent for doing this. Over the last 20 years, reconciliation has been used time and time again. It was used by Bush to pass tax cuts when he first came into office. In fact, the COBRA program, which is a program where people who lose their job can keep their health insurance, is actually, it's not called COBRA because it has to do with snakes. It's called COBRA because it's the Consolidated Omnibus Budget Reconciliation Act. So lots of things have been passed by reconciliation, and I just think it's quite unfair to sort of characterize it as something that, you know, is illegitimate to use in this particular scenario.
Pass or fail, what's it all going to mean for the people of New Jersey?
For New Jersey, it's questionable at best. The idea is come up with a solution, come up with some idea, some plan. Going back in the early 90s, I was asked to come up with a plan for New Jersey, and we came up with a thing called the Smart Card. In essence, what it does, it's a credit card-sized element that on the back of the card, the surface is similar to what you have on a CD or a DVD. That card can hold between 1,200 and 1,800 pages of printed and digitized text, including your x-rays, your dental charts, your MRIs, and so on. If you can put all of that information on a card, and then have everyone be on board with that process. It will reduce costs to the hospitals. It will get the doctors paid. The insurance companies were even on board with this and were willing to put money into it as well. So, I mean, there's a more complicated explanation as to how it works, but the idea is that you pay $1 for everyone who is involved with the claim. New Jersey hospital claims alone run between 400 and 500 million claims a year. If you have 4 people on every claim, 4 times 4, that's $1.6 billion in produced revenue to help underwrite the cost of a system that might be a better way to go.
Look, at the end of the day, the healthcare system across the country is in crisis. The healthcare system in New Jersey is in crisis. We have over 1 million people who don't have any insurance. We have people whose rates are going up. My own organization had a 34% increase this year from Horizon, which is actually supposed to be a nonprofit health insurance company, raising our rate 34%. We simply couldn't afford it. We're a nonprofit organization. We had to downgrade our health coverage policy, and now we're basically paying more and getting less. And so there is no question in my mind that Congress does have to move forward and pass health care reform. The bill before Congress, both bills that passed last year and the compromise that they're working on, while it's not perfect, and I think people on both sides of the aisle will have disappointments with it, at the end of the day, it will cover 30 million more people across the country. It will regulate the insurance industry. No born denials for pre-existing conditions. No more rescinding your health coverage when you get sick. If you lose your job, there'll be ways to get affordable health coverage for you. So I think there are a lot of other ideas. I think the senator's idea of the smart card is certainly a way to lower cost and improve efficiency in the healthcare system. But I do think we need our leaders in Washington to produce some real comprehensive reform.
Thank you both for joining us. If you have ideas about topics you'd like to see discussed, please log on to my9tv.com and click on Public Affairs. We want to hear from you. That's all for today's show. Thank you so much for joining us. For My 9, I'm Brenda Blackman, and we'll see you next week on New Jersey Now.